Hi, my name is McKenzie Harper. I am the program manager for education for the Dr. Lorna Breen Heroes Foundation. And I am so thankful to be here with you, Dr. Cunningham, to talk today about your story and all that you are able to share with us, and looking forward to learning from you and speaking with you today.
I am a surgeon by trade. I'm a surgeon at Massachusetts General Hospital. I'm also a researcher. But the way I wound up here is having my own difficulties, struggles with mental health. I was a very competitive tennis player. At a very young age, I started playing when I was 6 or 7, and was playing internationally by the time I was 11, and playing professionally by the time I was 16. I was a pretty driven individual, and after I retired at the ripe old age of 21, I wanted to prove to everyone I wasn't just an athlete. And so I said, what is the hardest possible thing I can do? And I proceeded to take an insane number of science courses, wound up getting into University of Michigan Medical School. And then once I was doing that, what's the hardest field I could go into? General surgery, let's do that. I think probably I was 17 the first time I had a first major depressive episode, and I didn't even know what it was. Didn't even cross my mind to talk about it, to ask somebody what it was, which is crazy. I was just so used to just especially in an individual sport where you're competing against people you're traveling with, and you're not going to tell them that you have any sort of weakness. You're not going to talk about it. And many tennis players, beyond the top few, travel alone or just with one other person or their coach. So there are very few people around to help with that. So I already learned at a young age to sort of take care of it myself, right? And that eventually went away, and I moved on, and we were used to sort of toughing things out, right? The way we trained and how long you can stay on a tennis court, and cramping and muscle aches and injuries. And that was just another injury that I sustained, that many people probably sustain. My chief addiction was working. And there are many, many people with that, where I would just work and work and work till I went to sleep at night. Literally, I'd be so exhausted. And general surgery residency is very, very good at keeping you super busy until you fall asleep. So immediately following quitting tennis, I was in college, I was in medical school, and then I did surgery residency. And then all of a sudden, 20 years went by. And I definitely had fluctuations within that period of time where I had major depressive episodes. But it was like, oh, I'm going through a hard part of my life. It's general surgery. Everything was hard enough to explain it. No one knew how to talk about it. No one knew what to do about it. Nothing changed, and this happens a lot. I think the statistics, and your foundation probably knows better the actual statistics, but around 400 doctors a year die by suicide. And surgeons are at the high end of that among other people, emergency room physicians. Yeah. Dr. Lorna Breen, anesthesiologists, and surgeons are really up there, potentially because of lethality, but also because of the level of stress and the acuity of the disease that they see, and that a lot of the immediate responsiveness, is your responsibility. I think that's key too.
I have read that you said that you're one of the toughest people and that you really felt like you could handle everything. And I imagine that must be a prevalent feeling for medical school students, residents who are very driven. And that's kind of a thread in our conversation, this drive to accomplish things that are significant. And thinking about that, is there something you would say to medical school students or residents who are struggling with something similar, this feeling that they're tough and should be able to handle anything?
I think a little bit of, the people who are drawn to doing that and to putting in the effort and the time, sometimes some of those people, it's because they feel like they have to escape, so to speak, or move on from their situations that they had. This, I can take care of myself. Perhaps for some people that is that they don't have other people that they've ever been able to rely on. So there's a little bit of that coming into medical school. And then there's the culture of we don't talk about it. You are around death and dying a lot. And in surgery, you're there at a point of where you could potentially be harming a patient inadvertently by a mistake you make. And the amount of pressure that mounts on you over the course of a very long and arduous time when you are not really seeing your family very often, you are not sleeping, barely seeing the doctor, not exercising. And the Dr. Lorna Breen Foundation and myself and other people are really trying to change the conversation and the culture so that it's expected. And I like to say that it's a professional, self-care is a professional responsibility, and it should be just as big of a responsibility as taking care of your patients.
Yeah.